Hello, I'm going to talk to you today about anti-wrinkle injections and what can go wrong with the upper face treatments. You see lots and lots of strange looking results from using these products, as many people are really quite untrained in using them, don't understand how the muscles work, or look for an appearance which is really quite strange. The commonest problem I see with these type of injections is a really flat low brow called brow ptosis, and that's because this muscle here that causes these lines across the forehead is paralysed. So as it's paralysed, the whole brow drops down. As we age, we use that muscle to lift up our brow, which is why we get the wrinkles. So one of the goals of treatment, I think, is people feel they ought to have a very flat, unwrinkled brow, which is fine when you're young, but as you age, it just looks quite strange and also gives you a very low, stern look. The other strange thing you see is that the middle of the brow is treated and the outside is not treated. So when the brain tells you to lift your eyebrows, the sides go up massively, sort of a quizzical, spot-like look, which again looks really quite odd. And the third thing that happens is the startled owl, where the middle part of the brow is low, so you get a kind of high arch to the brow like that. And that's really due to the middle of the brow being treated, so the lifting muscles in that area are paralysed, but the rest aren't. So all those things cause a really sort of not a rested, fresh look, but just quite odd. So the treatment of the brow in older people, particularly with low brows, is to treat the middle of the brow, the glabella here, which are the muscles that bring the brow down and in, and also the muscles here, which pull the lateral brow down. That way you get a fresh, rested look. Yes, you can move your forehead, but it does look more, your eyes look more open. So I think that's a much better approach to people with lower brows initially than trying to freeze the whole thing to within an inch of its life, and it looks really quite strange. I'm going to pass on some more tips in my next video. I hope that's helpful. Thank you very much.